Hello, everyone. Welcome to the webinar Dynamics in School Health Promotion. We will start at the whole of the hour. My local time is 2 o'clock in the afternoon, but I know it's different from the different parts of the world where the other participants may be from. So welcome. This is a webinar that's been organized together by the Schools for Health in Europe Network Foundation and the UNESCO Chair Global Health in Education. This is the second of our joint webinar series. We had one earlier on in January about health literacy. And today we're happy to share with you the work done by our colleagues from Maastricht University about the dynamics in school health promotion. And we all know that when you are involved with implementing the health promoting school approach, that creating change in the school system is challenging, since schools are dynamic organizations and each school operates in its own context and interventions should fit with that context. So it's very interesting to hear from our colleagues who did a lot of work on this particular topic from the Maastricht University, and they titled the webinar Dynamics in School Health Promotion. We will have 3 speakers, all from the same university, Nina Bartelink, Kathelijne Bessems, and Steph Cramer, who will all be contributing in their own way to this webinar. And we'd like to have this webinar to be as interactive as possible. We all have getting more and more experienced in doing these kind of events via online tools like Zoom. And we are very happy that you took the time to attend this particular one, to make the interaction with you as live audience with our speakers possible. First of all, I would like to invite you to use your questions using the Q&A button at the bottom of your screen. It's obvious, I think. And the other one is that we also have a tool, an app that we call WooClap. And on the next slide, you can see how you can log in to this link. It's also in the chat, or will be in the chat, the link to the WooClap. And in the WooClap, the first question to you as audience is, in keywords, what are in your view, the most important outcomes of school health promotion? And later on, during the webinar, we will share with you the results of what you've put in. So please actively make use of this possibility to contribute. So now it's my pleasure to introduce Nina Bartelink, my dear colleague from Maastricht University, who is a researcher and working for the School of Public Health and Primary Care at the Maastricht University, on how you can deal with studying the dynamics in school health promotion. So Nina, the floor is yours.
Thank you very much, Prof. I will start share my screen now. Just a little check, does it work?
Yes,
yes,
perfect.
Great. Okay, thank you, Prof, for that very nice introduction. As Prof already said, I will try to answer in the next 10 minutes this question and talk about the dynamics in school health promotion. But I think it's good to first start with the health promoting school approach. As you already probably know, the health promoting school approach was developed by the World Health Organization to work in a structured and integrated way on a better health and improved health behaviors for all people in the school. And the whole school approach was the main principle behind it. So having a focus on the whole school system instead of focusing only on, for example, health education in the classroom. And even though different definitions exist of the health promoting school approach worldwide, they all have similar underpinning principles, and they target the following 6 core components, which are the healthy school policies, school's physical environment, school's social environment, individual health skills and action competencies, community links, and health services. But implementing health promoting changes in the whole school system can be quite challenging. Schools are very dynamic organizations in which many unforeseen things can happen. And I think nowadays we more and more realize that we should see schools as complex adaptive systems. And some main characteristics of such a system are, for example, that there is a lot of interaction. There are many interacting components on the personal level, the environmental level, the organizational level, and these interactions, they are non-linear often. Large efforts can lead to nothing, but also small efforts can produce large effects. Another characteristic is that they are open systems, so nested in other systems like families, neighborhood, and also there are continuously interactions. And as you can imagine, that creates that each school has its own unique context, and that there's in some way unpredictable. There is no guarantee that a health promoting initiative will really create the expected changes. So how can you deal with that dynamic in school health promotion and with these challenges? Well, I think we think that important is that you should always take the school context into account, because every school is different, has their own needs, opportunities, wishes, and that means that when you take the school context into account, that there is no one size fits all of the health promoting school approach. That means that flexibility is needed and that you need a tailored translation of the approach. And as you can imagine, that will create a variety of choices. To illustrate and to support you also in what kind of choices that you have to or what you can make, we identified 7 spectra on which you can navigate. And I will now discuss each spectrum one by one. But before I will do that, I think it's important to say that there is no right or wrong. It depends really on the context, what works best, what fits best. So even when you're more leaning towards the left side or the right side or more in the middle, that's all fine. It's just you really have to look at the context of your specific situation. Okay, then the first spectrum, it's focusing on the involvement of stakeholders. When you lean more to the left side, so more top-down focused, it means that the intervention package is mainly developed, implemented, evaluated by people from outside the school, such as health professionals. And this can be quite helpful because you can make use of the knowledge and the skills and the expertise of these people. When you lean more to the other side of the spectrum, it's the bottom-up part. And then that means that school staff, children, parents, all people in the school are much more involved in the whole process. And I think it can create more ownership and engagement from the people in the school. And it can help to create a better fit with the context. The next spectrum, it's about the core components, what I talked about earlier before in the presentation. When you lean more to the left side, then you address, maybe focus on one single core component, for example, the physical environment, and you can put all your efforts and resources to address that core component. But you can also focus on multiple core components, which can be more complex, but I think sometimes quite needed when you want to target, for example, very wicked health problems such as obesity. The third spectrum, it's about the development of health promoting interventions. You can adopt existing interventions, but you can also develop totally new interventions. Of course, when you develop new, it's more time consuming, it costs more money, but you can really make a good fit with the specific context that you're working in. I think a very nice example of adopting an existing intervention is the Active School Flag initiative, which aims to develop a physically active school community. And it was originally from Ireland, and Italy and Lithuania, they adopted this initiative with the help from EU funding. And I think even though differences exist between the countries, I think it's a nice example that it shows that you can even adapt existing interventions across borders. The fourth spectrum, it's about how it fits into the school curriculum. You can add on, or when you lean towards the left side, you add on more the interventions. So it can be a bit easier to implement, but it often costs more. It creates more workload for the teachers. When you lean towards the other side of the spectrum, add in. That's probably much more complex, but it becomes much more integrated into the school curriculum then. The fifth spectrum, the disruptiveness of the health promoting interventions as part of the health promoting school approach. When you lean towards the left side, then you have the non-disruptive changes. They are like they kind of smooth in. They're like how we say it in Dutch, like the low-hanging fruit. It's a bit easier to implement probably, but you can also decide to focus more on a bit more disruptive changes, the right side of the spectrum. That's probably a bit more complex and difficult, but it can really trigger the school system and create a more focus on health and well-being and create momentum for additional health promoting interventions. And I think a nice example of that disruptive intervention is the Healthy Primary School of the Future. It's an initiative that I worked on during my PhD, and we created a positive disruption in the school system by offering a free healthy lunch each day. And maybe in many of your countries that's quite normal, but in the Netherlands we are used to that children bring their own packet lunch. So you can imagine that was quite disruptive for everybody in the school. And we saw that this lunch really acted as a catalyst for wider school health promotion, that the schools felt as a healthy school from that moment on, and it was easier to implement additional health promoting changes. The sixth spectrum, it's about the different types of research. The left side of the spectrum, it's about the RCTs or other controlled designs. They have a strong focus on internal validity, and they can be quite helpful and useful when you want to investigate the effectiveness of the HPS approach. And when you lean more to the right side, the action-oriented research, then you focus much more on the process and understanding what's happening in the specific context, and also to really provide support to the school to improve implementation. And important aspects here are continuous monitoring and feedback loops. Then the seventh, the last spectrum, it's about the dissemination. You can disseminate it very local, just to the let's say, the school next door, but also national dissemination is possible, or something, of course, in between. I think a nice example is the Curriculum for Excellence. Maybe you know about it. It's the new educational framework for the schools in Scotland. They have decided to include health and social emotional well-being as a new component of the school curriculum. And it has been identified as the responsibility for all school staff, together with literacy and numeracy. So that were the spectra. And I think in conclusion, important to say is that it's when you navigate on these spectra, it's a continuous process. It's not just one decision that you make, but it can be different also for each situation that you, for each change, in time, it can differ. So it's really a continuous process. And I hope, or we hope, that these spectra can provide you some insight in the variety of choices, and it can provide you some support for the development, implementation, and evaluation of health promotion in each specific context, school context. Yeah, you can also see the reference here. So if you want to read more about it, we wrote a fact sheet. The fifth fact sheet is focusing on this. And for each spectrum, then we also have an example to illustrate it, what we are talking about. Okay, that was it for now. Thank you very much.
Thank you, Nina, for your excellent presentation, and kept very well in the time schedule that we have fixed for this webinar. And thank you for presenting these 7 spectra. It's quite a new way to describe the complexity of the fields that we are working in. And it's a very interesting and, as you say, a navigator to help us in the process of implementation of health promoting schools. I'm just checking with Sylvia, my colleague, to see if there are any questions from the Q&A that you would like to share with Nina on her part of this webinar.
Thank you, Goof. There are no questions at the moment yet.
Okay.
But we do encourage you to ask your questions.
Yes. And we also do encourage you to go to the WooClap link that we have in the chat to put your keywords on what are the most important outcomes of school health promotion. I have one question to you, Nina, can you say a little bit more about what you think are the practical implementations, the practical consequences of making the 7 spectra as you presented these in your presentation?
I think, yeah, good question, Gove. I think it can provide some more insight and more that you get conscious about the decisions that you make, and that you be conscious to really look at, okay, what works for our school and where are we on the spectrum, and is that really what we want? So I think that that's a very important implication of it, yes.
And what schools do think of the spectra themselves?
Sorry?
What do schools think of these spectra themselves, the people in the field?
Actually, I don't know.
Okay. Well, we might get feedback from our...
I think that's very, very relevant to, because they're quite new, these spectra. And I think we're now in the process of, and I think Kathelijne will talk about that as well, to really see how this works and if it works in the field. And to see if it's helpful for them. I hope it's helpful, but yeah, we have to see that. Yeah.
Thank you very much. Before we move to the second presenter, Kathelijne Bessems, we want to put our second question in WooClap. So again, that's a way for you to communicate or participate in this webinar. And this is the other question, which is, here it is on the screen. What are the barriers and facilitators, in your view, of implementing school health promotion? So again, you can answer these questions in the WooClap, the same link as you have had before. And at the end of this webinar, we will show the results of these two questions and have our presenters give comments and feedback on that. Okay, so now I have the pleasure to introduce my colleague Kathelijne Bessems. She is also working at Maastricht University as a senior researcher and lecturer, and will talk with us about how does the European region deal with the dynamics in school health promotion. So, Kathelijne, over to you.
Thank you for the introduction, Prof. Give me a moment to share my screen with you. Does that work for you?
Yes, it works fine. Thank you.
Great, thank you. Okay, so welcome everybody. It's nice that you are all attending this webinar. My name is Kathelijne Bessems. I work at the same department as Nina and Stef. And I'll be talking to you in the next 10 minutes about some of the findings of a project we conducted last year for the SHE network, and that's the Schools for Health in Europe Network Foundation. So we received an operating grant from the European Union's health program to do this specific task. And in this project, we aim to get insight into the extent into which the SHE member countries implemented school health promotion and the formal health promoting school approach. Further, we wanted to get insight in the way in which the SHE member countries balanced on the spectra Nina has been talking about a few minutes ago. And we wanted to get insight in the perceived barriers and facilitators of the implementation of the health promoting school in the SHE member countries. But before we continue, I would like to briefly explain to you how we define school health promotion for this task. So Nina has nicely introduced the health promoting school approach, but school health promotion relates to various activities, health promotion activities in schools, such as physical activity in a curriculum or a school policy. And this does not need to imply that the school has a systematic plan according to the principles of the formal health promoting school approach. So it can also be just standalone activities. And then the health promoting school approach, that's what Nina has been talking about, refers to schools that do implement this structured and systematic plan. And this then relates to the health and well-being and development of social capital of all pupils and teaching and non-teaching staff. And this is then characterized by this whole school approach. Active involvement of pupils and staff and parents is very important in this one. So I think the main difference between both approaches is that the first is then not so systematic. It doesn't have to be systematic like the second one. Second one is integrated. It's a system approach. And these are the main important differences. So within the SHE network, each country has a national coordinator. So Nina has been talking about what can you do? Well, I think that's what she was referring to was the field of health promotion. For example, the national coordinators, but also maybe coordinators at the local level, health promotion professionals. And in the SHE member countries, there are national coordinators. Some have some regional coordinators. And we conducted a survey among all these health promotion coordinators. And we did that last year in September and October. So it's good to keep in mind when you interpret my findings that these do not reflect the interpretation from the schools itself, but the interpretations from the national coordinators. And of course, they did use a lot of national data to support this if these were available. So we had 24 out of 40 countries participating in the study. And here you can see the diversity of countries that participated from, for example, Azerbaijan to Wales to Sweden and Italy. So it's quite a diverse group that participated. So first, the national coordinators estimated the percentage of schools involved in school health promotion within these countries. And the numbers in the graphs in red indicate the number of countries, just to help you understand what I'm showing you here. And the colors in the graph, as you can see in the blue circle, represent the percentages of schools working on school health promotion within these countries. The light green is then the lower percentage and dark green is the higher percentage. Overall, we can see that in 9 to 15 countries, depending on the school type, all schools implement health-related activities. So that's quite positive, I think. When we look at the school type, it shows that this is the highest in primary schools, followed by the secondary schools, and it's a bit lower in the vocational schools. In the next figure, then we can see that school types that are formally working according to the health promoting school approach. So that was what Nina was also talking about, the systematic approach. And what we can see here is that in 2 to 5 countries, all schools work according to the health promoting school approach. So this number is substantially lower than health promoting activities, as shown above. And the number of schools in which less than a quarter of the schools works according to the health promoting school approach is 8 in preschools and goes up to 11 in vocational schools. I think overall this implies that the systematic and integrated health promoting school approach is less common than school health promotion in general. And that might not be a very surprising finding, though it's still an important confirmation, I think. So our second aim was to get insight into the way the schools in the SHE member countries balance all these health promoting spectra, like Nina introduced previously. And for this, again, we asked each coordinator how schools in general scored on these 7 spectra within their specific country. And of course, this is a simplification of reality, as there will be differences between schools, within regions, within the country, but it does show us some general trends within the countries, I think. So in the next slides, I've added the mean scores of the countries as well as the range, and that's then the highest and the lowest score that national coordinators ticked off. For example, for the first spectrum, grown from top down to bottom up, it's indicated in orange here. It shows us that some of the countries, mainly top-down approaches are used, indicated by the 2 in the range, while in other countries, mainly bottom-up approaches are applied, indicated by the 9.3 in the range. And then there's the 5.1 that indicates the mean score of the 24 countries. So what are the results now? Overall, in the SHE member countries, there is a trend towards adopting multiple components, indicated by the 6.3. Non-disruptive approaches, indicated by the 4.4. Add-in approaches, indicated by the 5.7. And finally, the action-oriented research, indicated by the 6.1. The mean score of spectrum 1, 3, and 7 is around 5. And again, this is at group level, of course. So overall, both top-down and bottom-up approaches were applied. Both existing and new interventions were used in schools. And school health promotion was disseminated both locally and nationally. And as said, there will be still huge differences between the countries. And you can see this in the range. So finally, I would like to share some of the facilitators and barriers indicated by the national coordinators about the situations in schools in their countries. So these seem to take place at different levels. So I've clustered them in 3 categories, and these include factors at national level, factors within the schools, and factors that relate to the support from, for example, health promoters. At a national level, existing collaborations between health and education sectors were very much facilitating in the countries, as well as the supporting infrastructures such as health promotion, the health promoting school being part of national policies. While at the same time, lack of funding, lack of fund coordination, and lacking definitions of best practices really inhibited the implementation of school health promotion within these countries. Within the schools, at the school level then, the support of the school management was important, as well as the motivation of teachers and a common interest in the topic, while limited time, high workload, and additional activities were considered to be hindering for school health promotion. And also bottom-up approaches were active, such as by actively involving students and other stakeholders using participatory approaches, were frequently mentioned by, as supporting, while competing projects really hindered implementation. And then finally, on the one hand, training and support of school coordinators were supporting, as well as the exchange of good practices between schools and other stakeholders. And on the other hand, then lack of local support inhibited implementation. So overall, I think these findings reflect that the national coordinators experienced factors such as support, best practices, fundings, and that they were not only needed within the schools and at local level, but also at governmental level. So all these levels were important and needed to be addressed. So to conclude, there are some huge differences between and within the countries and the way they implement both school health promotion and the health promoting school approach. And although we aim for an integrated formal health promoting school approach, support for both the school health promotion activities and the health promoting school approach is important. We believe that school health promotion may serve as a catalyst for stimulating schools and countries to evolve to a health promoting school approach. Sometimes schools or countries may not just be ready for the health promoting school approach yet, but later on they will be. And then systematically targeting the combination of relevant barriers and facilitators at multiple levels is likely to enhance implementation. But of course, this really requires time and continuous efforts. So if you're interested in the country-specific results, we've prepared some country-specific reports for this. You can have a look at these reports, which can be found at the SHE website. And of course, we also prepared a short overall summary. Yeah. So thank you for this.
Thank you, Kathelijne, for doing your presentation and giving us a very good insight in what's happening actually in the countries that are member of the SHE network in the European region. And it shows again the diversity. And when you share these results, I'm always interested in the 16 countries that did not participate in the survey and what they are doing. And it's obvious that we are not there yet and with your work. I was checking with Sylvia to see if there were any questions coming in on the Q&A. Sylvia?
Yes, thank you. There is one question.
Yes, please.
That is, as the school curriculum is already quite overloaded, what can be done in such case to encourage schools to participate in educational school health promotion programs?
Yeah. I think that's a good one. It's also a difficult one. I think what we've experienced in the project we've been doing is start talking to schools. So start looking for opportunities together with them, and don't just talk to them about what they need to do, but what they want to do. And often they are already doing a lot of things. So by redefining what they are already doing and then maybe just taking small steps forward, I think that would be a good way to get started. But the main thing is, it's not us as health promoters, researchers, telling them what to do, but talking together, co-creating, seeing what the opportunities are, and especially what they are already doing. Because I think also when you saw how many health promoting activities that are already going on within schools, great respect for what they are doing there. So
thank you. Was that the question you found, Sylvia? Yeah, okay. I have also a question, maybe you want to answer that, Kathelijne, because you said it's the current situation in the countries. Is there anything you can say about the COVID-19 impact on the school health promotion activities?
Yeah. Actually, that was one of the questions we added to this survey. So what's going on regarding to that? And I took a note because I expected that this question might come. So I think one of the things that they have been dealing with a lot is first the distance learning that has been quite difficult, of course. So a lot of effort has been going towards that. Also, yeah, the mental health of the students, but also the teachers who have been overloaded with everything. Some countries told us that, for example, physical activity, which was a topic which was really important pre-COVID, because they could spend a lot of time on that, was now a bit, less. It was not that it wasn't important anymore, but they could spend less time on it because they were really focusing on the primary process of getting education going. So that was something they also told us. Many also talked about the social economic health differences, which were increasing, like the children who were doing worse, getting more behind, while the children who are doing well, getting less problems from this homeschooling. These were the main topics the coordinators talked about.
Yeah, thank you. We can also find these in the report that you just shared.
Yeah, exactly. Yeah.
Thank you very much. Okay, I'm checking with Sylvia to see, because we still encourage you colleagues to put your questions in the Q&A, and also we have the WOOC lab. There seemed to be a technical issue with accessing the second question. Sylvia, can you tell us if that's working or not?
It should be visible now because I see people answering.
Great. So before I give the floor to the next speaker, I would encourage you to again look at the WOOC lab and answer what in your view are the main barriers and facilitators for implementing school health promotion. So having said that, I'm happy to give the floor now to the third speaker, which is Steph Cramer. He's professor at the Maastricht University. And can you share your screen? That's great. Professor of obesity prevention. And you will talk, Steph, about how does this work contribute to the future of school health promotion and school health promotion research. The floor is yours and the shared screen is working.
Thank you very much, Prof.
Can you share your screen again?
Yes, I will.
Thank you.
There we are. Oops. This is where I wanted to take you. This is my first slide. Yes, I have been a professor in obesity prevention for a couple of years, 5 to be exact, and I did that with a lot of enthusiasm. For the past couple of years, I've been professor in health promotion, so actually broadening my scope beyond obesity prevention, but it's true that I still do quite some work in the area of obesity prevention. And I will indeed take this opportunity to think a bit along with the audience about the future of health promotion and health promotion research, and what the results that Nina and Kathelijne just elegantly presented might mean for this future. I took this graphic that you can see on the screen now, because it might seem that while Nina and Kathelijne were talking about dynamics in school health promotion, that it was still, that you can still interpret this as some kind of stable thing, that you are at a certain position on a certain spectra on a given point in time. But actually, what Nina and Kathelijne have been telling is something that looks like this. So you can put it on a spectrum, but in essence, in real life, schools work like this. Very dynamic, constantly interacting elements, and also not only within the school setting, but also beyond the school setting. And well, if you look at the world from that perspective, then there are a couple of implications that I would like to discuss with you. And I put them on this screen as some kind of warning. So each of these points I will go into some detail in the time that I have. So starting with this life course perspective, I think it was very interesting that the European inventarization that Kathelijne did showed that the attention for health promotion at schools appears to decrease while children get older. And that's actually rather strange, especially I think many of the people in the audience work in a university setting, or at least work with professionals that are trained at an academic level. And we have seen here that, you know, the school as a university is also suffered from the COVID epidemic quite drastically. So our students really suffered from it. And it's actually strange that the universities tend to give little or hardly any attention to health promotion for their own students. And I think that the same goes for other higher educational levels. And you see it actually decreasing as children get beyond primary schools, which is actually kind of strange. So I would like to advocate, and I hope, and I think that's also the future of school health promotion, is that, that this life course perspective is taken. So health promotion is already there at preschool level, at kindergarten level, and is continuously there. The attention for health and health promotion is continuously there as the children grow older, up until they are at the end, towards the end of their school career. So it's actually kind of mixed hope about where I think the future is and where I hope the future is. And let's say I hope I am correct. And another thing where I feel and hope that we are going towards is the contextual approach that was touched upon by one of these spectra as well. I think we are giving much more attention to so-called upstream determinants of successful implementation. So not only the tips and tricks that you can do as an advisor of school health promotion, but also taking into account, for example, deep-rooted cultural factors, deep-rooted organizational factors that are present at a particular school. And then you need to do different things, and sometimes more intense things, than just handing over a couple of tips and tricks for schools, because that doesn't work in most cases, we know. And the last thing that is accompanying a contextual approach is to see the school as part of a broader system. So it's not the school as some kind of isolated place on an island. No, it's part of this broader system. And if you look at it from this systemic approach, then you need to take into account non-linearity. Nina already said it. Sometimes a lot of effort is put into schools, and I know many people in the audience that are working in the field have experienced this, putting in a lot of efforts in helping the school climbing this hill towards a healthier environment. And sometimes it works for a bit, and this ball is leaving this basin just below there, and you see some kind of successes. But if you stop putting in effort and attention, typically the ball rolls back to the basin again, and to this so-called attractor state. That's where the school wants to be, in the attractor state, which is the state that people do the things as they have always done, routines, following the way that the way of working has been formed over the past, sometimes even dozens of years. And it's very hard to help schools move beyond that. So a lot of effort, no effect, or hardly any. Very non-linear. Luckily, the opposite is also sometimes true. That's what gives us energy, right, as health promoters in schools. When we encounter a school that is at a tipping point. So asking you to give them this final push by using a particular word or by introducing them to a particular person, adding something to this system, the crucial element, and a huge effect is taken, and the school is drastically changing the way the system works in order to facilitate healthier behaviors in the system. And that's a so-called tipping point. We call that a tipping point, or in systems theory terms, a bifurcation point. So relatively few attention, few effort, but huge effects. Also very non-linear. If I take too long, the host just interrupt me. Yeah, it happens sometimes when I get enthusiastic. Then I take more time than I had.
You're okay.
Okay. In the systemic approach, actually, what you do as someone who stimulates a healthy school approach is create feedback loops. So observe and feedback. And so the school is helped in that way to take actions that might be out of sight for someone who is in the system themselves. So in this process of navigating, I think that what the research up to now has shown that this idea of navigating is a very central skill for professionals. So I think good professionals that stimulate health promoting schools are very good at navigating. So that means that they have a competency to be flexible. So not to have, this one box of tips and tricks, put them on a desk and hand over some tips and tricks, and the same box is for everyone. No, I think good health promotion is about feeling what a particular context needs. We sometimes call that contextual sensitivity, and then navigate on each of those spectrums to the point where you feel, okay, this is the point on the spectrum that I have to take now in order to help this school in an optimal way, and in order to help the school adapt to this particular situation. You might call that mutual adaptation. Taking some point between very top down and very bottom up. And this competency, I think, should be trained better. So that's a responsibility that I take as someone who trains professionals in the future to be able to navigate better. And in the organizational literature, it's also sometimes called adaptive management. Adaptive management. So I think our professionals should be scoring high on adaptive management. Otherwise, they can't function properly. Just going through your protocols, going through your steps, same way every time isn't going to work, at least not for those schools that are not at a tipping point. And the last point that I want to make, in line with one of these spectra that Nina already presented, I think that if you take a research perspective on school health promotion and health promoting schools, we need to navigate as a research community towards the end of the spectrum that is action-oriented. I think we need to move beyond RCTs. Of course, RCTs are sometimes good, but in very rare cases where we need to test efficacy trials and test whether a particular isolated intervention might work, very good. But for the remainder, I put much more value in participatory approaches, where the researcher is a member of a team and is a person that also takes responsibility for creating feedback loops. And that also means for the PIs among us that we need to dare to design research without predefined output or outcomes. It's very challenging, also for our grant offices, because they want to know what they are subsidizing. But in essence, if you listen carefully to this webinar, I think it's sometimes very difficult to predefine where we are going in a particular context. So we need to be, a bit of thinking outside of the box and don't have predefined output or outcomes of our efforts and convince are subsidized by the fact that this is actually where we need to go. Well, we are thanking a lot. This is the third time that you see this slide, but we are a very thankful people in Maastricht, you know.
Thank you so much, Stef, for your, as always, thought-provoking presentation and learning that navigation is a very useful skill in supporting schools to become health promoting schools and to be flexible and adaptive in this process. Thank you so much. Because of time, I would like to switch to Sylvia to see if there are any questions in the Q&A button that Stef could answer. Sylvia.
Yes, we actually have 3 questions, 2 following the discussion that we had after the presentation from Kathelijne. The first one is, do you have any information on how the different approaches to implementation related to pupils' outcomes?
Yes, I think I'm reading with you, Sylvia. I think I know what Anna means. And the different approaches. So I think, you know, let's say the adaptive versus non-adaptive approaches, or what we know from our own research, but also, you know, research across the globe and reviews have shown this, that the more adaptive our approaches are, the more sustainable they are going to be over time. And I think that's a crucial element of successful health promotion initiatives. When they are sustainable over time, they will be more successful in terms of pupil outcomes. We know that changing health behavior takes time if you want to do it properly. And if you can show that particular approaches are more sustainable and, you know, institutionalized in schools, and it's for sure that they are in the end leading to more positive pupil outcomes.
Okay, thank you. And there were more questions, Sylvia?
Yes, a second question is what school health coordinators can do to take action to improve health and well-being and equity for students and educators in a post-COVID world.
You want to answer that, Stef?
Yeah, maybe Kathelijne and Nina can assist me as well. Of course, we are thinking about all, aren't we? You know, what is the world going to be like post-COVID, and how can we, you know, make healthy choices easier in the post-COVID world? What I do see around me already is that I've been in the business quite a while. I've never actually experienced a period where, let's say, health promotion has become more important and has been given more value than these days. So I think what COVID has learned us, besides many other things, that, you know, it's vitality, well-being, prevention are really, really important. And I hope that this will also lead to political commitment at local and national levels. And local at schools in this case, but also on national levels where I think, well, I think we have all experienced the importance of schools and school health promotion in a period where we couldn't go to school, right? So it was total chaos, at least. That's what I've witnessed as a parent.
Yeah. Is there anything your colleagues, Nina or Kathelijne, want to add to this particular question? Kathelijne?
No, I
Okay.
think it's no. No.
Okay. Nina?
No, me neither. Maybe one thing I think it's good to really keep the conversation going with the schools, like really to hear what they need and what they need in this time, but also after COVID. I think that's quite important.
Okay, thanks. Sylvia, there was a third question, which was more reflecting to what Stef presented.
Yes, well, it's more in general, maybe.
More in general.
That's the education and health sectors are considered as key stakeholders in school health promotion. But what about the food and agricultural sector?
Steph?
Yes, great question. So if you see schools as part of a total system, then the food sector is as important as the health sector and as the educational sector. Well, we've seen some good examples where actually on a local level there have been links between the food sector, local caterers, or local grocery stores that were involved in school health promotion, and that can be very successful. And I think this also has to do with responsibility, right? So that those sectors also acknowledge that they are partly responsible in, let's say, the whole wickedness of the context around health and health promotion. So sometimes they're part of the problem, right? The food sector is essentially part of the problem of for example, obesity, but they're also part of the solution. And so they need to acknowledge that they are responsible, and they need to take responsibility for this as well. And sometimes they need a little nudge towards taking this responsibility, for example, by financial interventions, subsidizing healthy food or putting tax on unhealthy foods. But also there, I see luckily I'm a positive guy. I see positive trends appearing.
Thank you. You said positive trends. I also heard positive friends. So maybe Sylvia, could you now share the results of the WOOC Lab questions? And maybe the first one was the first one. What in keywords are, in your view, the most important outcomes of school health promotion? And here you can see the result. And maybe who of our three panelists would like to feedback on that? One of you, raise your hand and then I'll give you the floor. Anyone? I see health in big letters, but Kathelijne? Just a short reflection.
Yeah, I think this really makes sense. I think it's also the most difficult to measure the health. That's really a long-term outcome. So I think we're not used to measuring health at the short term, but in the end, this is what we all do it for, of course. And I'm glad to see students, children, competencies also very central here. So yeah.
Anyone from your colleagues? Yes, Stef,
yeah,
please.
What I like about it is that this word cloud is actually very broad. So it almost takes a positive health approach. You may know this concept of positive health, which states that health is more than just the absence of disease, and it consists of multiple dimensions. So I'm not sure if you would have asked this question 10 or 20 years ago if the scope was as broad in the word cloud as it is now. So I really like seeing words like empowerment, engagement, happiness. So yeah, great.
You're happy with this one?
I'm very happy.
Good. Okay, Nina, you want to give a comment?
Yeah, actually, I totally agree with Steph. It's I was looking at it, and it's so diverse. So that's very nice to see, I think.
Yeah. Okay, thank you. And now we also have the feedback from our audience today of the factors, the barriers and facilitators of implementing school health promotion. Could you make it slightly bigger? But the screen, is that possible, Sylvia? Or is it just me? Yes. Okay. So here are a number of barriers and facilitators that was mentioned. And maybe Kathelijne, you can reflect on that, because that was also what you were sharing.
Yeah, I think it's quite recognizable and comparable to what we found in the project. And of course, yeah, I think an important barrier also focus on examinations. Yeah, totally agree. This is of course still the main priority in schools, to work on learning improvements and knowledge and skills. So I think the most important thing is to make a link between the two. And I think there are some nice examples how you can do that, but yeah, it's always will be challenging. And of course, the enthusiastic teachers and the commitments, also very important. Management support, yeah. And of course, the time, all the time-related schedule, workload, I think we all know that's also, yeah, very common barrier, yeah.
Anyone else from our presenters?
Maybe one
Nina.
nice thing to add here. It's not about the content, but I think it's nice to say that this year, Kathelijne and I and some other people in the project team, we will focus on the barriers and facilitators of school health promotion in 2021. For SHE, we will make a report about this. We will look at different countries in the SHE member countries, and we'll really have a detailed look about it. So because now it's quite in general what we studied, what Kathelijne presented, and we will now have a detailed look about it in different countries. So I think that's nice to mention, and this report will be finished and published on the SHE website in January 2022.
Okay, thank you very much, Nina, for this addition, and great. We look forward to read this report in the near future. We are at the end of our webinar. We heard about the dynamics of school health promotion from the different presenters. I want to thank you, presenters, for excellent presentations. And I want to thank you, participants, for joining us. I want to refer that we have a webpage on the UNESCO Chair website and also on the SHE website with additional information and resources. We will have the videos of the presenters. We will have the links that were also shown during this webinar. We will also have the results of the word cloud and the discussions. So that can be used for you as well in the future as additional resource. And with having said that, I think at the end, I didn't forget anything. Sylvia? I did not. Then we close this webinar and wishing you a very good day. Thank you very much.